mentioned, we are glad to be here today with Tiffany Netter, who is the Executive Director of 504HealthNet, a critical organization that is supporting a number of frontline primary healthcare centers throughout the city of New Orleans. And they've done some really interesting and critical work around addressing health disparities, both before COVID-19 and now in the midst of COVID-19.
Thanks, Michael. So I'm Tiffany Netters, and I serve as the Executive Director. And 504HealthNet was created actually post-Katrina, so post a crisis or disaster. Federal government provided a large grant to the state to rebuild the primary care system in New Orleans. And so 504HealthNet was born as a collaborative body where these organizations came together to really work together for collective impact to ensure that all of the neighborhoods and most of New Orleanians were covered regarding primary care. Up until today, 504HealthNet serves as this collective impact body where we have 27 organizational members who receive benefits from 504HealthNet when it comes to professional development, capacity building, health policy advocacy, and we also serve the community in that we help navigate community members to these members' services when it comes to primary care, behavioral health, dental, and the other social services that our members provide. Our members are a diverse group of healthcare organizations that range from the federally qualified health centers all the way up to the large hospital system, LCMC. And so because they provide so many different types of services, we definitely feel like we impact the majority of New Orleans residents when it comes to primary care needs, behavioral health needs, and then the emergency specialty needs that hospitals provide.
The grant that Blue Cross and Blue Shield of Louisiana Foundation made early on this COVID impact was specifically designed to address health disparities. And we've seen that our friends at the Greater New Orleans Foundation and various others have also come to invest in those lanes of work, recognizing its critical importance. Can you paint a picture of the sort of overall way in which funders are working together in support of the work of 504HealthNet, in support of the various member institutions to make sure that people have the resources they need to aid in prevention, to aid in care, and to ultimately get people hopefully back home and healthy in the days and weeks to come?
Blue Cross Blue Shield Foundation's crisis grant to 504HealthNet has allowed 504HealthNet to serve as that hub to get the needed resources out to our 27 members. And so with this opportunity, we created 504HealthNet's Lifesaver program in honor of the life-saving services that our members are doing. And we created 2 different tracks of resources. The first track is through a mini grants program where our members were eligible to submit a small application to us for a $5,000 grant, in that they were able to use it either to buy additional PPE or supplies, they could incentivize their staff for working overtime, and they can do direct patient assistance. And then the second track is that it allowed us to get the needed PPE resources and coordinate the distribution as a system for New Orleans. These healthcare providers in our community health centers are on the front line, and they are providing resources, services, treatment to patients who are the most vulnerable in our community. So that's why it's very important that we support them.